Do you ever stand at the bottom of a staircase and feel the weight of every step like a mountain you're forced to climb? You glance up, heart racing, breath shallow, and wonder if you'll ever make it to the top without pausing to catch your breath. You're not alone. Thousands of seniors face this silent battle every day, and the solution isn't a risky operation or an expensive device. What if I told you that 5 simple surgeon-approved movements, each lasting less than 2 minutes, can restore the confidence to take the stairs again? Imagine stepping onto a curb with ease, feeling the smooth lift of your foot, hearing the quiet click of your heel as you rise without strain. That's the promise we're about to fulfill. I'm Dr. Anna Martinez, orthopedic surgeon with 20 years of experience treating mobility loss in older adults. I have watched countless patients avoid the staircase out of fear, watching their independence slip away one step at a time. I understand the frustration, the embarrassment, the anxiety that builds each time a simple flight becomes a daunting obstacle. In the next 15 minutes, I will guide you through the exact 5 exercises that target the muscles, joints, and balance systems essential for effortless stair climbing. These movements are not only approved by surgeons, they are grounded in solid biomechanics and have been proven to improve gait after ankle and knee procedures. First, we'll explore why stairs feel harder after 60, then we'll break down each exercise using a clear 3-part formula, identify the problem, explain the biological benefit in plain language, and give you a step-by-step instruction you can try right now at home. By the end, you'll have a practical toolkit you can practice daily, and you'll understand the science behind each motion. Let's begin by understanding the anatomy of climbing. When you ascend a step, 3 things happen almost simultaneously. Your calf muscles push the foot off the ground, your quadriceps lift the thigh, and your core and ankle stabilizers keep you balanced. As we age, the calf and quadriceps often lose strength. The ankle loses its range of motion, and the proprioceptive feedback that tells us we're stable becomes less reliable. The result is a feeling of heaviness, a wobble, and sometimes a painful knee or shin. But the good news is that each of these components can be retrained with targeted, low-impact work. Now let's move to the first exercise, the heel rise and lower. Weak calves reduce the push-off power you need to lift your body onto the next step, forcing you to overuse the hip flexors and making every step feel like a climb. Strengthening the gastrocnemius and soleus stores elastic energy, turning a stiff push into a springy lift off. The same principle surgeons rely on when they restore gait after ankle surgery. To perform this movement, stand behind a sturdy chair, feet hip width apart, slowly rise onto the balls of your feet. Feel the stretch in your calves. Hold for 2 seconds, then lower back down in a controlled manner. Complete 2 sets of 12 repetitions, pausing 30 seconds between sets. Keep your knees slightly bent, avoid locking them because locked knees transfer the load away from the calves and can stress the joint. Give yourself 10 seconds now to try the rise and lower. If you felt the gentle stretch in the back of your lower leg, go ahead and tap the like button. It lets me know this tip is resonating with you. The second exercise focuses on the quadriceps, the primary drivers that lift the thigh onto the next step. After years of reduced activity, the quads often atrophy, leaving the knee unstable and giving that unsettling, giving away sensation many seniors describe when they step up. Reactivating the quadriceps improves knee stability and reduces that fear. Sit on a sturdy chair with your back straight and feet flat on the floor. Extend one leg straight out, keeping the foot flexed. Hold for 3 seconds, then lower it slowly back to the floor. Alternate legs, completing 3 sets of 10 repetitions per leg. If you notice any knee discomfort, shorten the hold to 1 second and increase the rest interval between sets. This gentle activation will awaken the muscle without overloading the joint. Which leg feels weaker to you? Leave a comment below and I'll address the most common concerns in an upcoming video. Now let's transition to the third movement, the seated hip flexor march. As we age, tight hip flexors limit the range needed to bring the knee high enough for a smooth step, and they can also pull on the lower back, creating discomfort. Stretching and strengthening these muscles enhances the swing phase of stair climbing, allowing you to lift the leg with less effort. Start seated in the same chair, hands holding the sides for balance. Lift one knee toward your chest, aiming for a 90-degree angle. Hold for 2 seconds, then lower. Alternate legs for 2 sets of 15 repetitions. Keep your torso upright. Avoid hunching forward, which would place extra strain on the spine. Take a moment now to try the hip flexor march. Feel the activation in the front of the thigh, the slight tightening of the lower abdomen. If this exercise is sparking a sense of possibility, consider subscribing. It helps the channel keep delivering surgeon-approved tips that empower you to move freely. We've covered 3 foundational moves that target the calf, quadriceps, and hip flexors, the core trio that powers stair ascent. The next 2 exercises will address balance and ankle mobility, the hidden pillars that keep you steady and prevent missteps. But before we move on, let's recap. Strong calves give you a powerful push-off. Activated quads stabilize the knee, and flexible hip flexors allow a smooth leg swing. Together, they create a coordinated chain that turns a daunting staircase into a simple path. In a moment, we'll explore the 4th exercise, a standing single leg balance hold, followed by the 5th, an ankle dorsiflexion stretch with a towel. Both are quick, safe, and can be done in any room of your home. Stay with me because the final 2 moves are the real game changers that will make you feel secure on every step. Now, take a deep breath, stand up if you're seated, and prepare for the balance challenge that will sharpen your proprioception and reduce the risk of falls. The 4th movement is the standing single leg balance hold, a simple yet powerful test of the nervous system's ability to keep you upright when the terrain shifts beneath you. Why does balance matter so much when you climb stairs? Imagine each step as a tiny platform that disappears the moment your foot leaves it. If your brain cannot accurately sense where your body is in space, you will overcompensate, wobble, or even lose footing. Strengthening the muscles around the ankle and hip while training the brain's internal map creates a safety net that catches you before a misstep becomes a tumble. Begin by standing tall near a sturdy chair or countertop, just in case you need a light touch. Plant your feet hip-width apart. Engage your core and gently shift your weight onto your right foot. Lift your left foot just a few inches off the ground, keeping the knee slightly bent. The goal is not to hover high, but to feel the subtle activation of the small stabilizing muscles in the foot, the calf and the outer thigh. Hold this position for a count of 3, then lower the lifted foot back to the floor. Repeat the sequence for 10 repetitions on each side, allowing a brief 30-second rest between sides. As you become comfortable, you can increase the hold time to 5 seconds, or try closing your eyes for a few seconds to further challenge your inner ear and visual cues. Take a moment now to try the balance hold. Notice how the muscles in the standing leg engage, how your hips stay level, and how a gentle sway may appear as your body searches for equilibrium. If you feel any sharp pain in the knee or lower back, simply lower the lifted foot and repeat with a smaller range of motion. Remember, the aim is controlled activation, not maximal strain. If this balance exercise is already giving you a sense of steadier footing, consider leaving a comment about how your confidence feels after the first few holds. Your experience could help others decide whether to start with a shorter hold or add a support surface. Now that we have addressed the core trio of calf, quadriceps, and hip flexors and added a solid balance component, the final piece of the puzzle is ankle mobility. The ankle joint is often overlooked, yet it plays a critical role in the push-off phase of stair climbing. Limited dorsiflexion, the ability to bring the foot upward toward the shin, forces the knee to compensate, leading to increased stress on the joint and a feeling of tightness after each step. Restoring full ankle range not only smooths the gait cycle, but also reduces the effort required to lift the foot onto the next tread. The fifth and final exercise is the ankle dorsiflexion stretch with a towel, a gentle maneuver that lengthens the calf, Achilles complex while encouraging the tibialis anterior muscle to fire effectively. Sit on the floor with your legs extended straight in front of you, a towel looped around the ball of your right foot. Keep the knee relaxed and gently pull the towel toward you, aiming to bring the toes toward the shin. You should feel a mild stretch along the back of the lower leg just above the heel. Hold this stretch for 15 seconds, then release. Perform 3 repetitions on each side, allowing a brief 20-second pause between sets to let the tissues adapt. Try the ankle stretch now. As you pull the towel, focus on breathing slowly, inhaling through the nose and exhaling through the mouth. Notice the subtle lengthening of the calf fibers, the release of tension that often builds after a day of standing or walking. If you encounter excessive discomfort, reduce the pull slightly and increase the hold time gradually over several days. Consistency is key. A few seconds each day will accumulate into meaningful gains in mobility. At this point, you have completed the full suite of 5 surgeon-approved movements: calf strengthening through heel rise quadriceps activation with seated leg extensions, hip flexor marching while seated single leg balance holds, and ankle dorsiflexion stretches. Together, they form a comprehensive program that addresses power, stability, and range of motion, the 3 pillars that enable a senior to ascend a staircase with ease and confidence. Let's recap briefly. Strong calves generate the push-off force that propels you upward. Activated quads stabilize the knee and prevent the dreaded buckling sensation. Flexible hip flexors allow a smooth leg swing without pulling on the lower back. Single leg balance trains the brain's internal map, reducing wobble and fall risk, and ankle dorsiflexion restores the full range needed for a fluid foot placement on each tread. When these components work in harmony, the staircase transforms from an obstacle into a routine part of daily life. You may be wondering how often you should perform this routine. The answer is simple. Aim for 5 sessions each week, allowing at least 1 rest day between sessions to let the muscles recover. On rest days, a gentle walk or light household activity can keep the joints lubricated without overtaxing the newly built strength. Over time, you will notice that the short burst of breathlessness you once felt after climbing a few steps begins to fade, replaced by a steady rhythm and a sense of control. Before we close, I want to share a quick tip that often makes the difference between a good workout and a great one. After you finish the 5 exercises, spend a minute walking up and down a single flight of stairs at a comfortable pace. Pay attention to how each movement feels. If you notice any lingering tightness, repeat the ankle stretch or the calf rise for an extra set. This real-world test reinforces the neural pathways you just trained, turning the exercises from isolated drills into functional strength. Now take a moment to reflect on what you have learned today. How does it feel to have a clear, surgeon-approved plan that you can perform in the comfort of your own living room? Imagine the next time you encounter a set of stairs at the grocery store, at a friend's house, or even in your own home. With these 5 movements integrated into your routine, you will step onto that first tread with confidence, knowing that your muscles, joints, and balance system are all working together to support you. If this video has sparked a sense of possibility, I invite you to share it with anyone you know who might benefit: a neighbor, a family member, or a fellow senior who hesitates at the foot of a staircase. Our community thrives when we lift each other up, both figuratively and literally. And as always, if you found value in these surgeon-approved tips, consider subscribing and turning on notifications so you never miss future health insights tailored specifically for active seniors. A simple click helps the channel continue delivering evidence-based guidance that empowers you to move freely and live fully. Thank you for walking through these exercises with me today. Remember, the journey to easier stair climbing begins with a single deliberate step, and now you have the tools to make every step count. Stay steady, stay strong, and I'll see you in the next video. Before you go, take a moment to picture yourself the next time you encounter a set of stairs, whether it's at the grocery store, a friend's home, or simply the step leading to your bedroom. Imagine the confidence that comes from knowing each muscle, each joint, each balance cue is ready to support you. That mental rehearsal is a powerful part of the training process. The brain begins to trust the body before the body even feels the difference. Now, I'd love to hear from you. Which of the 5 movements felt the most challenging and which gave you the quickest sense of relief? Drop your thoughts in the comments below and I'll respond personally to the most common questions. Your feedback not only helps me tailor future videos, it also builds a community where we all learn from each other's experiences. If you found today's guide useful, consider sharing it with a neighbor, a family member, or anyone you know who hesitates at the foot of a staircase. A simple forward can spark a conversation that changes someone's daily life. And if you're ready for more evidence-based strategies, whether it's improving balance, protecting joints, or maintaining mobility, click the like button. That tiny gesture tells the algorithm that this content matters to you, and it helps more seniors discover the tools they need. Finally, for anyone who wants to stay up to date with surgeon-approved health tips, hit the subscribe button and ring the notification bell. It's a small click that ensures you never miss a new video designed to keep you moving with confidence. Thank you once again for joining me on this journey. Keep practicing, stay patient with yourself, and remember that every deliberate step you take today builds a stronger, more independent tomorrow. I'll see you in the next lesson.